Hello, future doctors. Welcome to the fascinating world of pharmacology. Let's start with the very basics. The World Health Organization, or WHO, gives us a beautiful and precise definition. It states that pharmacology is the study of the effects of drugs on living systems. Think of it as the science that explores how a substance, when introduced into a living organism, produces a change in function. This isn't just about pills and potions. It's about understanding the intricate dance between a chemical and our body's complex biological machinery. It's a cornerstone of medicine, helping us turn simple chemical compounds into life-saving therapies that can fight infections, manage chronic diseases, and alleviate suffering. So, where do all these magical molecules, our drugs, actually come from? The sources are incredibly diverse and tell a story of scientific evolution. For centuries, nature has been our primary pharmacy. Plants have gifted us invaluable drugs like morphine from the opium poppy for pain relief, digoxin from the foxglove plant for heart failure, and quinine from the cinchona bark to treat malaria. These natural blueprints are still vital today. Even today, a significant portion of our modern medicines can be traced back to a natural origin, reminding us of the powerful chemistry that has been brewing in the natural world for millennia. Beyond the plant kingdom, we also look to other natural sources. The animal kingdom provides us with essential hormones like insulin, which was originally sourced from pigs and cows to treat diabetes, and heparin, an anticoagulant derived from animal intestines. Minerals have also played their part. Think of iron supplements to treat anemia, lithium carbonate for bipolar disorder, and even simple substances like magnesium sulfate. These natural sources, from plants to animals to the very earth beneath our feet, have formed the foundation of our pharmacopoeia, providing us with powerful tools to combat disease and improve health for centuries. But modern medicine has taken a giant leap forward with the advent of synthetic chemistry and biotechnology. Many drugs today are created entirely in a laboratory. This synthetic route allows us to design drugs with specific properties, improving their effectiveness and reducing side effects. Aspirin is a classic example of a synthetic modification of a natural product. Even more exciting is the field of biotechnology, which uses living organisms or their components to produce drugs. This has given us incredible monoclonal antibodies for cancer therapy and powerful vaccines, all designed with precision at the molecular level. Understanding these sources is crucial because it helps us appreciate the drug's properties and potential. Once we have a drug, the next big question is, how do we get it into the body? This is where the route of administration comes in, and choosing the right one is absolutely critical for a drug to work effectively and safely. The route determines how quickly the drug starts to work, how much of it reaches its target, and how long its effects last. We can broadly classify routes into two main groups: enteral, which means through the gastrointestinal tract, and parenteral, which means any route that bypasses the GI tract. The choice depends on the drug itself, the patient's condition, and the desired speed and site of action. It's a key clinical decision you'll make every day. The most common, convenient, and safest route is the oral route. You simply swallow a tablet, capsule, or liquid. It's easy for patients to self-administer at home, making it perfect for long-term treatment. However, it's not always the best choice. The drug has to survive the acidic environment of the stomach and then get absorbed from the intestines. Some of it gets broken down by the liver before it even reaches the rest of the body, a phenomenon we call the first pass effect. This route is also unsuitable for emergencies where a rapid effect is needed, or for patients who are unconscious or vomiting. For a faster and more predictable response, we turn to parenteral routes. The intravenous route is the king of speed. By injecting the drug directly into a vein, we achieve 100% bioavailability, meaning the entire dose reaches the bloodstream instantly. This makes it ideal for emergencies, like treating a severe infection or a heart attack. Other common parenteral routes include media group, nurse administering intramuscular injection in upper arm, close-up of syringe injecting into muscle at stalk at distribute_equally, intramuscular, where the drug is injected into a muscle, and subcutaneous, where it's injected just under the skin. These routes provide a slower, more sustained release of the drug compared to intravenous, which can be very useful for certain medications like vaccines or insulin. And there are many other specialized routes. The topical route involves applying a drug directly to the skin or mucous membranes, like using a cream for a skin rash or eye drops for glaucoma. This is great for achieving a local effect with minimal systemic side effects. The inhalation route, using an inhaler or nebulizer, delivers drugs directly to the lungs, perfect for treating asthma. The sublingual route, under the tongue, and buccal root in the cheek allow drugs to be absorbed directly into the bloodstream, bypassing the harsh GI tract and the liver's first-pass metabolism. Each route has its own unique set of advantages and disadvantages, and selecting the right one is a true clinical art. After a drug is administered, its journey through the body begins. The first step for most routes, except intravenous, is absorption. In simple terms, absorption is the process by which the drug moves from its site of administration into the bloodstream. Think of it as the drug's ticket to ride the circulatory superhighway. For an oral drug, this means moving from the gut into the blood vessels lining the intestine. The rate and extent of absorption are hugely important because they determine the concentration of the drug in the blood, and ultimately, how intense its effect will be. If a drug is poorly absorbed, it won't produce the desired therapeutic effect, no matter how potent it is. Several factors can influence how well and how quickly a drug gets absorbed. The drug's own properties are key: its size, its lipid or fat solubility, and its formulation, like whether it's a tablet, capsule, or liquid, all matter. Generally, smaller, more lipid-soluble drugs pass through cell membranes more easily. Patient-related factors are also crucial. The route of administration, as we've discussed, is a major determinant. The presence of food in the stomach can either enhance or decrease the absorption of certain drugs. The blood flow to the absorption site is also important. Greater blood flow means faster absorption. It's a complex interplay of variables that we must consider. Once the drug is in the bloodstream, it's time for the next stage of its journey: distribution. Distribution is the process by which the drug reversibly leaves the bloodstream and enters the tissues and fluids of the body. The goal is for the drug to travel from the blood to its specific site of action, where it can bind to receptors and produce its effect. For example, an antibiotic needs to distribute from the blood into the infected tissue to fight bacteria. The efficiency of this process determines whether an adequate concentration of the drug reaches the target organ to be effective. It's like a delivery service, ensuring the package gets to the right address. Just like absorption, distribution is influenced by several factors. Blood flow is a major one. Organs with a rich blood supply, like the brain, heart, and kidneys, receive the drug more quickly than tissues with lower blood flow, like fat and bone. The drug's ability to bind to proteins in the blood, mainly albumin, is another key factor. Only the free or unbound drug can leave the bloodstream and exert an effect. Some drugs can cross special barriers, like the blood-brain barrier, while others cannot. This is why some drugs can treat brain infections, while others are ineffective. Understanding distribution helps us predict where a drug will go and what effects it might have. After a drug has been absorbed and distributed to do its job, the body needs a way to get rid of it. This process involves two key phases: metabolism and excretion. Metabolism, also known as biotransformation, is the chemical alteration of the drug within the body. The primary goal of metabolism is to convert lipid-soluble drugs, which are hard to excrete, into more water-soluble or polar compounds. This makes them easier for the kidneys to filter out and eliminate from the body. The liver is the main superstar of drug metabolism, containing a whole family of enzymes, most famously the cytochrome P450 system, that work tirelessly to chemically modify drug molecules. Drug metabolism is critically important in pharmacology. It's what usually terminates the action of a drug and is a major determinant of how long a drug's effects will last. Some drugs are administered as inactive prodrugs and actually rely on metabolism to be converted into their active form. Levodopa, for instance, is metabolized in the brain to dopamine to treat Parkinson's disease. However, metabolism can sometimes be a double-edged sword. It can lead to the formation of toxic byproducts. A classic example is paracetamol or acetaminophen overdose, where the normal metabolic pathways become saturated, leading to the production of a toxic metabolite that causes severe liver damage. Once the drug has been metabolized into a more water-soluble form, it's ready for the final step: excretion. Excretion is the removal of the drug and its metabolites from the body. While drugs can be excreted through various routes like bile into the feces, sweat, saliva, and even breast milk, the kidney is by far the most important organ of excretion. It acts as a sophisticated filter, removing waste products and water-soluble drug metabolites from the blood to form urine. This is why a patient's kidney function is so crucial. If the kidneys are impaired, drugs can accumulate in the body to toxic levels, requiring a dose adjustment. In a clinical context, Understanding metabolism and excretion, collectively known as drug elimination, is fundamental to safe and effective prescribing. It helps us determine the correct dose and the frequency of administration for a patient. For instance, a patient with liver disease may metabolize a drug more slowly, requiring a lower dose. Similarly, an elderly patient with reduced kidney function may need a smaller dose of a drug that is primarily excreted by the kidneys. This entire journey, from administration to excretion, is what we call pharmacokinetics, what the body does to the drug. Mastering these principles will empower you to use medicines wisely and safely for your patients.